So my name is Annie Valtierra-Sanchez. I am the director for SOHealthE, which stands for Southern Oregon Health Equity Coalition. For us to be able to take part in a larger committee, a statewide committee that is looking at all the inequities and figuring out ways to address it, as this is where we want to have a voice and to be able to be able to be part of that conversation and change, right? um, when policies are made, when decisions are made, when funding comes in, where those things land ultimately will impact community members. So if we want to have a bigger impact, we want to be able to give that voice and say, well, this is what it looks like down in with community members. And so being part of the SHIP and the subcommittees has been key and very intentional for us to say this is important. So we can't just work down here in our own community. We have to be part of the larger system. What I am very glad is to see the priorities that came out in the end, right? We came up with 5 priorities that to see trauma, toxic stress, and that was where the subcommittee that I served in being addressed, right? Because it looks different. And again, so if you have trauma, toxic stress, you don't just go to the doctor, address it. It has to do with the environment. So being able to be part of the process where we're thinking of the strategies that will result in better outcomes, hopefully, was like really exciting. What is put in place for accountability? I think that's what community wants to see, like not just tell us that there's something, but we want to see it happen, and we want to know who's responsible, who we go to if it's not working. So I think that's what's the excitement for me and us as a coalition to say, well, we be able to tell the difference, that if something is happening, that something is changing, and who is taking out of that, who's keeping it going, who's being accountable to make sure that those changes are implemented.